Welcome to NHP's On Your Mind, a special 8-part series on 99FM where we engage with various healthcare professionals to unpack a number of extremely relevant topics related to the well-being of Namibians. We will also be addressing the mental, psychological, and physical attributes of the points at issue and share valuable information and advice to the Namibian public. Mental health is very prominent. So what do people need to know to be empowered around the subject?
Okay, so the biggest thing is they need to know what the possible symptoms are.
Okay.
So in general, things like feeling like you don't want to get out of bed in the morning, or lack of interests, feeling like you don't want to go out and have fun with your friends, you have no drive, no energy to complete tasks, struggling to sleep or sleeping more than usual. Some people hear voices that are linked to other mental disorders, or some people are hyper or very low in mood, low libido, lack of appetite. Those are all possible symptoms of mental health. Okay. And if people can recognize them, they can realize that I need to see a doctor or I need to visit a clinic and tell them these are my symptoms and I possibly need to get help.
Yeah. You know, when you're mentioning all of those possible symptoms, I'm just like, mentally we're ticking off some of it. And it's quite scary to know that I could have a mental health issue. And then you get anxious around it. So why is it that we are so reluctant or very stubborn actually, just to make those lifestyle changes that will serve us in being healthier?
I think the reason why we're stubborn is we don't realize that there's help, firstly. And the other reason is I think people have this general misconception that being healthy mentally and physically might be expensive or costly. They're afraid to go to the doctor. The medication is going to cost them a lot of money, or the doctor's visit is going to cost them a lot of money. But there's free clinics, there's a psychiatric outpatients department, and they can actually really get help for themselves. So if they can get around that misconception, and you can go walk around the block to exercise, that costs absolutely no money.
Yeah.
And there are so many street vendors where you can buy fresh produce and healthy eating and all of those things, just to keep your body and your mind healthy. Yeah. Because in general, they are linked to each other.
Okay.
Whatever we feel mentally, we can present as physical symptoms.
Oh.
I can give you an example. In teenagers, when they are depressed, they can present with headaches. Wow. Depressed or anxious.
Yes.
Because they're not just teenagers, toddlers. They don't know how to express their symptoms. So then you need to go deeper and investigate. Some people come to the hospital and they mute. They don't want to talk to you. And then it has to do with mental health once you start digging deeper.
Oh, wow. So finally, your message to Namibians, because all of this seems like it's just a lot of information, but like you said, we do have places and people where we can go to seek help and things that we can actually do to get better. Yes.
So my final note to Namibians would be, it has been a very difficult time with the pandemic over us, not being able to visit people like we want to, being isolated for long periods of time, and that can all have an effect on mental health. It's important to realize family is important. Spend as much time with your own family as possible and concentrate on things that make you happy and healthy. Reading a book, listening to music, having fun with your kids. Yeah. If it means watching a movie on a Friday night, those are the kind of things that can make you happy and improve your mood, your mental health, and your physical health.
I like that one. Do things that make you happy.
Yes.
I'm thinking about what I can do for myself.
Take yourself for a pamper session.
Even a homemade one, because they're like, maybe the budget's a bit tight, but do a homemade
put a face mask on, paint your nails.
Thank you.
I often do that on a Sunday.
No, definitely. It's what's self-care day?
Self-care is very important.
Day. Thank you so much, Dr. Klazen, for joining us. We really appreciate you being here.
It is a pleasure. It was a pleasure being here.
And that's it for part 2 of 2 of NHP's On Your Mind, where we spoke to Dr. Raquel Klazen to answer the question, how are we doing generally? Thank you for joining us. Till next time.